Good afternoon. Welcome to the daily briefing here at St. Clair County EMA, joined by Chairman Mark Kern and, of course, the young lady of the hour, Sam Bierman from the St. Clair County Health Department. It's like a roller coaster.
It is. We have our good days and bad days, and today, certainly, it's not a bad, terrible day, but we're definitely seeing some higher numbers today than we have in the past couple days. So as of today, 7,769 COVID tests have been performed in St. Clair County for St. Clair County residents, with 1,299 positive test results, which is an increase of 42 from yesterday, and that does include males and females from their 20s up to their 100s. We are at 6,458 negative test results, with 12 results that are still pending. And we do have some sad news to announce. We are adding 2 additional deaths today, which brings our total in St. Clair County up to 99. The first was a female in her 90s. The second was a female in her 80s, and both did have underlying health conditions. And as always, our sympathies go out to their families. For those individuals that have completed the IDPH required 14-day quarantine, we are at 817. And for state totals, we are at 934,704 that have been tested, with 122,848 positive test results, which is an increase of 1,614 from yesterday. And the state's reporting 5,525 deaths today, which is an increase of 113 from yesterday. For our hospitalization numbers, and these are for hospitals that are in St. Clair County, currently we have 58 people that are admitted due to COVID-related reasons, and 5 of those individuals are on ventilators. For congregate living facilities that are in outbreak status, and that is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, Brea of Belleville has 39 cases and 3 deaths. Brea of Cahokia has 8 cases and no deaths. Caritas Family Solutions in Belleville has 11 cases and no deaths. Caseyville Nursing and Rehab has 3 cases and no deaths. Cedarhurst of Shiloh currently has 11 cases and no deaths. Cedar Ridge of Lebanon has 12 cases and 1 death. Colonnade Senior Living in O'Fallon has 4 cases and no deaths. Four Fountains in Belleville has 104 cases with 24 deaths. Help at Home in Belleville has 2 cases and no deaths. Help at Home in O'Fallon has 5 cases and no deaths. Knollwood Retirement Center in Caseyville has 8 cases and 1 death. Lebanon Care Center in Lebanon has 54 cases and 10 deaths. Memorial Care Center in Belleville has 43 cases and 5 deaths. New Athens Home for the Aged has 44 cases and 3 deaths. St. Paul's Home in Belleville has 40 cases and 11 deaths. Swansea Rehab and Care Center has 15 cases and 2 deaths. And finally, TDL Incorporated in Belleville has 4 cases and no deaths. And I will turn it over to Chairman Kern.
Thank you, Sam. So we had a lot of new positives today, but there were 412 tested.
There were.
So we're still somewhere around 10%.
We are.
11%.
And while it seems like a high number, and it is a little higher than what we've had in the past couple of days, you have to look at everything surrounding that, which is the number of tests that have been done in relation to the number of positives that we have.
But it shows there's a lot of people out in the community that are going to get tested that might not have realized they had
that is
COVID,
correct.
And now they're finding out, and then they're
isolating.
Going home. They're
yes.
isolating, and that's how we're going to contain this.
Exactly, and hopefully stop the spread of COVID.
Great. Thanks, Sam.
You're
Always.
welcome.
So today's zip code report, remember, if you don't hear your zip code, it doesn't mean that you don't have anyone that is COVID positive in your zip code. It just means you haven't risen to the level above 5 yet. So in 62059, we remain at 7. 62201, we went up by 1 today to 18. 62203, we went up by 1 to 44. 62204, we went up by 2 to 47. 62205, we went up by 2 to 49. 62206, we went up by 4 to 113. In 62207, we went up by 4 to 80. And in 62208, we went up by 1 to 79. In 62220, we went up by 4 to 143. 62221 also went up by 4 to 111. 62223 went up by 3 to 51, and 62226 went up by 5 to 145. 62232 went up by 1 to 27. 62239 remains the same at 15. 62243 remains the same at 8. 62254 went up by 7 to 42. 62257 remains the same at 11. 62258 remains the same at 17. 62260 remains the same at 7. 62264 went up by 1 to 40. 62269 went up by 1 to 74. And 62285 remains at 14. So those are the numbers. Remember, they're cumulative, and we've been adding on to them every day. You've been tuning in every day and watching with us. So we'll continue to keep an eye on those zip codes. In those zip codes are people who may need help through the St. Clair County Grants Department. Today we're joined by Rick Stubblefield. Rick is the director of the St. Clair County Intergovernmental Grants Department. And Rick is here today to talk about a couple programs. First of all, Rick, how are things going? Do you have a lot of customer action over there, people that need your help?
We do. Chairman, we have been unbelievably busy. As you can imagine, the Grants Department is really designed to help individuals and families in crisis. And right this minute, there's an awful lot of individuals and families in crisis. So we've been very, very busy. I think we have sent out to date over 1,500 applications for community service block grant and LIHEAP applications. That doesn't take into account what's been downloaded from the website. Those are just ones that we have physically mailed out. We appreciate everybody's patience and understanding with the number that we have to get through. We have brought on additional staff. We're kind of revamping the way we do things. So we're moving along, and we will get through all of them. And
so once you get through the application, then the dollars are flowing, you have the money that's available?
That money is there, and that money is flowing. We are writing checks. We pay out every 2 weeks. It's a matter of getting the applications in and having all the supporting documents that go with it. So I would ask, as people send in their applications, go through the checklist. Make sure that you have the income verifications, the social security numbers and cards, the identification, the things that we ask for on it. It saves us having to go back and forth via email or regular mail to collect those, and it would speed up the process greatly.
So define those benefits. So LIHEAP is power bill?
LIHEAP is utilities. LIHEAP is low income home energy assistance. So that's your power bill, your Ameren bills in our areas, but we've expanded that through community services block grants, and we've also added water and sewer bills to that. A lot of municipalities have trash associated with the sewer bill, so if that's part of that bill, we'll add that on there. We are doing rental assistance, we are doing mortgage assistance, we are doing car payments, we're doing car insurance assistance. We've done some medical insurance payments. So we're trying to help people, stay at least even or not fall too far behind when this kind of breaks and people can go back to work. And these dollars really, truly, the ones that come through the CARES Act, are designed for individuals that were affected by COVID. Your hours have been cut. You've lost your job. You're laid off, or you've had extraordinary expenses. We have individuals that may have grandchildren that have come home and they're staying with them now because college is closed and they need a place to be. A lot of people have had a lot of extra expenses associated with cleaning and food and different things that you don't normally have. If you have 2 kids home from college, it costs a lot more to fill the fridge. So,
and a lot of these are people who've never accessed a program like this before, and there's no issue with that. If you're in need because of COVID-19, apply for these dollars.
And you're exactly right. You have paid into this system. That's what this money is designed for. You know, obviously everything is a confidential through the grants department, but you should be applying for them. You know, there's no reason for you to be going back and forth and fighting with a mortgage company or landlord if we're here to help and we can kind of get through and help you get over the hurdle a little bit, if you will.
So beyond those programs, because near and dear to our heart is making sure that our businesses reopen, the ones that we're used to patronizing during the year and the years, to make sure that they reopen. You put together a business program of help for businesses that have been affected by COVID-19. Can you talk about that?
Sure, I can. And we have, and this is a different pot of money. It's from the CARES Act, but it's through the Community Development Block Grant funds. So these are funds that we normally access for infrastructure projects, for maybe home rehabilitation, things like that. And we've taken that CARES Act money and worked with you to develop a small business loan plan, if you will. And this is going to be a 0% interest forgivable loan in an effort to try to make this as fair as we possibly can. We are keeping it to small businesses. So if you, and we've staggered the dollar amounts. So if you are a business of 1 to 5 employees, you can access up to $5,000, 6 to 10 up to $10,000, and 10 to 25 or 11 to 25 up to $15,000. These are full-time equivalent employees, so restaurants, that have a lot of part-time. You still very well may qualify for this.
So it's designed for mom and pop.
It really is, and the design, Chairman, is to help individuals get kind of back on their feet or get started again, with some of the expenses that they may have had as a result of COVID and shortened hours or being closed by the governor's orders. So what we want to do is help with that payroll if we can, help with those startup expenses when you get back. That's really the design here, is to
So the forgivable part, how is it? How do you qualify to not have to pay that back?
And all of this will be, it is now on the website. This application is on the website, and it'll all be in there. But in essence, the way this is going to work is there will be a promissory note signed, just like you would with the bank. After a certain amount of time, this loan will be forgiven. It's going to be a year, and I hedge a little bit, because while we put this on application online and while we're rolling it out now, our purpose in doing that is to make sure we're a little bit ahead, because we believe that HUD is going to sign off on this completely. They haven't yet, but we believe in all of our conversations with them, in all of the meetings we've had, that they are going to. They're just a little slow with the pen.
But you're taking applications now. They'll all be put there. If the application is equal to the amount of money you have to access, then everyone will get their application. If not, there will be some sort of a drawing out of a fishbowl or something to be a fair way to make sure that everybody that qualifies gets an even chance to get a grant.
And you're exactly right. So everything, if we have an overwhelming amount, and I expect that we will have a great demand for it, then we will throw them into a fishbowl. There's a date, and I want to tell you that it's June 22nd, but I won't swear to that we'll take applications up to. We will draw on whatever date that is that's in the application, and we'll draw them in order. We'll go 1 through whatever that number is, and we'll look at it. If there's other documents that we need, we'll request them from you, and our desire is to write checks as fast as we possibly can. And again, that's why we want to take them now, even though we're not 100%. We want to have everything in place to move forward.
So as soon as HUD says okay, you're ready to roll.
The applications should all be verified. They should be in our hands, and we should be able to just start writing checks.
Great. Well, anything else that you want to say? You're doing a great job, and I know your staff's working hard to make sure that anyone who needs help during this is getting it, and we appreciate that.
And they really are, and I appreciate all the help and support that we're getting from
And as always, you've got a phone number that people can call if they have questions?
Absolutely. If you have any questions, you can call 618-825-3200. That will get you to Jennifer Little, and Jennifer can point you in the right direction. Everything that we have is accessible on the homepage of the St. Clair County website. Our applications, not only for community service help, for individual help, is there, but now the small business loan application is there as well.
Great.
All right.
Thanks, Rick.
Thank
Thanks
you.
for being here today, Herb.
Absolutely.
You know, I just wanted to mention that Rick has really been working at your direction with the food pantry. Him and I are working on that at your request, and we're getting that list put together. So Rick's ready to really get that rolled out also to help out those food pantries throughout the county. So another project that is being made available to the people. So very good.
Thanks, Rick.
Thanks, Rick. Appreciate it. A couple of things. I wanted to just give a shout out to the Ogles Neighborhood Watch on April 30th. We did a little virtue meeting with them, and they sent us a nice little thank you card. So it's always great when people recognize when you're doing something good. So the staff here at the EMA was appreciative to that. The one announcement that I just got to make a correction on your list today. A parent of Muscuda was removed from your list because of some incorrect information. It was reported to the health department. That's why they weren't on the list today.
Okay.
So we just, we're trying to be transparent, and we want to make everybody aware of that. We talk about numbers, and some of the followers on our briefings have mentioned over time about, what do we all do here? And so I asked the staff just to put up a little simple graph. Hopefully you can see it there, and I'm going to hold it up there. But this is some of the numbers and some of the graphs that the staff here at the EMA and the health department monitor daily, a couple times a day. In fact, it comes in. This is the region's hospitalization graph. You can see, I like to refer to it as the heartbeat. You can see up here at the high point, the highest was 121 patients back on April the 14th. As of today, we're down to 85, which is up from 58, which was on May the 24th. So as we talk about all the time, the numbers we're really watching is these hospitalization numbers to make sure we meet those metrics. And I like what you say, regional wise, we're doing well what we need to be. We're in phase 3. And we're seeing phase 4 down the road here, but we want to keep these numbers going down.
And those are regional numbers.
These are regional numbers. And so we see a spike, but again, if we all continue to do what we supposed to be doing, the social distancing at all possible, that's what we want to do. Another thing that we want to talk about, the EOC remains open, not only for the COVID-19, but as the chairman, we're monitoring the protest that's been going on around the country, and we're monitoring some. We've had some peaceful ones here in the county, in Belleville over the weekend. We continue to monitor them. We've been in contact, as you know, with the mayors and the chiefs, and we're going to continue to do that. So I know you've had some calls in your office today that you fielded. Some of the business owners want to know if there's anything to worry about.
Well, and the sheriff is on this, and state's attorney's here for a meeting now. Jim Gomerick is here, and we're just talking about this, making sure that we're prepared for whatever. But we're in full support of protests, and done in an orderly fashion is a good thing. So we're here though, monitoring the situation just in case something would happen.
We will, and I think this is another example. We go from we're still in the COVID-19 mode, and now we will monitor this. But I think it just shows how strong Team St. Clair is. And we will get through another, as long as the water doesn't rise again anytime soon, we'll be okay. So that's what we have today for the briefing. We'll be back tomorrow afternoon at 3:30, and we'll be back momentarily with our young ladies to translate this in to our Spanish-speaking communities. Thank you.